Hello and welcome to a special edition of Community Connections titled Local Legends, where we are honoring and want to learn from extraordinary people who have transformed systems and connected thousands of people to life-sustaining resources over the course of their careers. If you work in the public or nonprofit sector in Philadelphia, you likely know, have heard of, and or had your life impacted in some way by our very first legend, Estelle Richmond. Estelle, thank you for honoring me by being our very first guest.
It's my pleasure to join you, Katrina. I really am deeply honored that you've chosen me to be your first guest on this program. So thank you.
Thank you. So for those who may not know your background, I'd like to share some of your most recent awards and a quick overview of your career. So Estelle most recently received the coveted Philadelphia Award for 2024 in its 103rd year. The Board of Trustees of the Philadelphia Award selected Estelle in recognition of her role as Executive Director of the Civic Coalition to Save Lives and her tireless efforts to drive the citywide coordination of effective evidence-based gun violence intervention strategies. Throughout her career, Richmond has held executive leadership roles at every level of government, including serving as Chief Operating Officer and Acting Deputy Secretary in the U.S. Department of Housing and Urban Development under President Barack Obama. Her tenure included a focus on access to safe, affordable housing as a precursor to addressing the gun violence crisis. Estelle also served as Secretary of the Pennsylvania Department of Public Welfare from 2003 to 2010, where she integrated services and expanded managed care. In 1999, she was appointed Deputy Managing Director of Social Services for Philadelphia, later becoming the first woman to hold the position of Managing Director for the city. She also served as the City of Philadelphia's first non-physician Commissioner of Public Health. Her advocacy led to establishing community behavioral health, overseeing mental health treatment through Medicaid, and the first nonprofit corporation created by a large city government. So, Estelle, tell us what drew you to the social services field.
Thank you, Katrina. I've been interested in social services probably most of my life. I came from a family of people invested in community life. My father was a medical doctor. My mother taught at a historically Black college and university, as did most of my family was either in medicine, in teaching, or in law. So it was very natural for me and my brothers to do something that basically was social services. I think that intensified in me as I lived through the era of civil rights and began to understand why certain sections of our society didn't work. And that meant so many people that looked like me. So my goal was to try, as it was my parents, to change that narrative. So I very much was committed to some field within human services. And that's been my life's work. And I have loved every second of it.
Yeah. So you certainly have many professional accomplishments, but please tell us about perhaps one that you are particularly proud of and why.
You know, people frequently ask the question of what am I most proud of?
Mm.
Unfortunately, I have to say there are two. I can't narrow it
Please.
down
Mhm.
to just one. But I would tell you one, when I became health commissioner and part of my work in Philadelphia, HIV and AIDS was a killer, particularly in the minority community.
Mhm.
And while and Philadelphia had been very hard hit. And I think that one of my first accomplishments was settling down the AIDS system. I used to call them, as passionate as they were a firing squad in a circle. In other words, we had providers fighting each other rather than fighting the virus. I think one of the things that I'm very proud of is helping people focus on the right solution,
Mhm.
and that it wasn't each other and fighting over the pie, it was making the pie larger so everybody got a piece of it. And I think it was a lesson in collaboration, a lesson in how you work with partners who were doing similar things that you were doing. They weren't your competitors, they were your colleagues.
Yeah.
Consequently, we were able to get several very large grants, which helped us expand the pie. And we began to put a system together that really worked and became probably one of the places that reduced our HIV, AIDS deaths significantly, and began to put together a system that worked.
Mhm.
Um, so I'm very proud of that because it actually saved lives.
Sure.
The second one, as everybody would probably connect me to, is the creation of a behavioral health system. And it really started with the closure of Philadelphia State Hospital.
Mhm.
I'm known both in Ohio and in Pennsylvania for deinstitutionalization. But
Mhm.
this closure was to be very different. We were moving people from a state hospital to the community with supports and with funding.
Okay.
Other times people have tried to do this, but if you don't have adequate funding, you leave very vulnerable people even more vulnerable and you contribute to homelessness.
Right.
Our goal was to make sure that we created a system of supports that by name could support not only all the individuals that would be moved from the state hospital, but we also had enough funding to create the people who didn't go, who would have gone, the people who we didn't have their name on, and that made all the system. Um, that's the basis of closing and creating that system is what laid the groundwork for 10 years later to create CBH,
Okay.
Community Behavioral Health. Without having that system in first and having it in place and having the money to support it, we never could have seen the vision or operated the vision to accept the contract for the state CBH. Incidentally, with the closure of Philadelphia State Hospital, the city budget in mental health went from $40 million to $80 million. So that was the basis of why we could do what we did. The creation of using the Medicaid dollars took us from being a stepchild to the managed care organizations to being in control. With the carrot at the other end, any effective operations and services, the dollars saved could be reinvested in the system.
Mhm.
Our first reinvestment, after only 6 months, we had saved about $2 million that was invested in the homeless system. And it was a real pride for us with Mayor Rendell and City Council President John Street to be able to invest in our system of homeless system because they didn't have an outside source of dollars. And though that part of our investment wasn't based on Medicaid enrollment, at that time. It was based in supporting new housing and new supports within that housing. So creating an HIV system that saved lives and creating a behavioral health system that was designed to reach more people are things I'm proud of.
Yeah, absolutely. I'm sure it's unmeasurable the impact that you've had. Really, the system is now over $1.5 billion system, and so I just think that the amount of impact you have and generationally on families is amazing. And so, thinking about that type of impact that you've had, and you spoke of just really briefly about the HIV system having the providers realize that they needed to work together and not against each other. I wanted to ask if you could talk a little bit about what you think are some of the key ingredients, so skill sets or strategies that social service professionals must employ to be effective.
Well, actually, after 50 years of service, I actually do have a list of things that I think can help people be more
Okay,
effective. Let me run through just a few of them.
please.
The first one in my book has always been probably my favorite, and it comes from a book called In Search of Excellence. And one of the concepts out of that book was ready, fire, aim. And what it means is plan, get ready, but then put your plan on the street and then fine tune it. I find in so many
Mhm.
times in social services,
Mhm.
people plan it and then they want to discuss it and then they plan it again and they plan it and they want the plan to be perfect. And to
Mhm.
many people, it appears that the plan is the activity. No,
Right.
the plan is never the activity. It's the operations. So plan it. I will always say plan, but then move it to operations. Get it on
Mhm.
the street and
Mhm.
then begin to fine tune it.
Mhm.
And at that point, work with everyone around you to do the fine tuning.
Mhm.
So for me, ready, fire, aim has always been a very key concept. Um, a second part of it is invest in staff.
Mhm.
Make sure that you include staff that are going to be involved always in the conversations. Leaders cannot operate without their staff, and their staff should not come in last. Their staff should come in first.
Mhm.
The corollary to that is, and it's become probably one of my favorite statements, and it comes from the world of ADAPT, which is a disability advocacy group, is nothing about us without us. So
Mhm.
if you're talking about people with mental illness, their lives, their families, I want them at the table.
Mhm.
Having them at the table at the beginning, not at the end, but at the
Mhm.
beginning, does a couple of things. One, it cleans up professional language. When,
Mhm.
when people are sitting there, I find professionals don't get careless. They talk about people. They don't talk about them or talk in derogatory terms. They become more. If you're talking about a plan, the people whose lives are going to be affected can tell you whether they think it'll work.
Right.
Listen,
Right. Right. Right.
if they don't think it's going to work, I guarantee you it will not work for many reasons. But they need to be at the table to listen and to be able to share their thoughts.
Mhm.
Another one I tell folks is to understand the difference between advocacy and activism. It is
Okay.
good to have advocates. It's even better sometimes to have activists. And part of that is there are things that those of us who work for government, there are things we can do and can say. There are other things we can't do and we can't say.
Right.
And those are things often that activists or advocates can do. And just to make a little difference, an advocate usually does talking. They may do a little lobbying, but they will talk to people.
Mhm.
Um, and activists change themselves to something. They stop the traffic.
Mhm. Mhm.
People have a hard time with activists because activists act with their bodies. They do something. They can become pretty strong sometimes. You know, you think about ACT UP, you think about ADAPT for people with disabilities, about like Joe Rogers, who was in the mental health field. But these are people who made themselves known because they felt they had to do something rather than just talk about it. There
Mhm.
needs to be a mixture, and providers need to understand that mixture and help people deal with it. My next one is flexibility.
Mhm.
You know, our clients don't read the rule books. They don't read regulations. They respond to life.
Mhm.
So part of what we have to do is be flexible enough to
Mhm.
be able to hear it and to make sure our rules and regulations can be adapted. For
Mhm.
me, no was never an answer. If someone needed something, my job was to figure out how to get it to them, not to find the excuse on why we couldn't. And sometimes today, I wonder, I think people rely way too heavily on the rules and regulations as opposed to looking at the individual and trying to find a solution to help them now.
Mhm.
And I think part of my reputation was built on how to figure out a plan A, a plan B, and a plan C, with the goal always being how do you help the individual get what they need to be able to have a decent life? And sometimes that works real well with the regulations. Sometimes you have to find the back door. Um, and the last one I'll do for this part, I came from a very close friend of mine who died way too soon, who was the budget director both at the city and the state by the name of Mike Mash, and I want to give him credit because what he would tell us frequently is don't let the perfect be the enemy of the good. We always want to achieve at the highest level, but sometimes we have to go through good and get a little better before we get to what is perfect.
Yeah.
But if you aim for perfect and that's the only thing you're looking for, you will probably miss a lot of occasions that you can just do good. So don't let the perfect be the enemy of the good. And let me stop there for a moment. I can go on this in 50 years of experience. You learn a lot of lessons about what works best for both people, the people who provide the service, the people who receive the services, and the system.
Yeah. No, I appreciate what the detail that you went into, and it was affirmation for me. I often find that we spend a lot of time, for example, on a plan, and people think that that's the end product or treat it like it's the end product, and that's just the beginning. And you don't
Okay,
know because life is unpredictable, and you can't control every circumstance how something is going to be deployed or operationalized. You can just do your best, and then you figure it out.
that's right.
So it's affirming to hear you say that. So I appreciate your wisdom with that. So I'm thinking about outside of government, but thinking about working with other sectors. So the public sector, the nonprofit sector, academia, health systems, for example. What do you think these sectors could do to be more collaborative and solutions oriented around shared goals? Because we have many shared goals. What can we do to be more collaborative in that space?
The key to collaboration is communication and bringing people together. I know that COVID changed much of our habits, but the reality is, if you can bring people together in a room and begin to talk very specifically about what you have in common, people will usually respond. But
Mm,
too often we talk to people separately and don't have them in the same room looking at the same problem. I've also found frequently, if I really have a dispersed group, is having using a case study format. In other words, this is a family. This is the some of the complications of life that this family is struggling with. What do we all bring to the table that could help this family have a different future? So sometimes the more concrete you can make it, the
mm,
more the tools are, and then use from that what are the common themes? What
mm,
are the ways that we can work together? But I have found over time that communication as specific as possible,
mm,
having people solve problems together, but basically begin to set out what are our shared values,
mm,
um, and how do we put those shared values to work.
mm,
I will also tell you, it's never a one shot meeting. So
mm,
if you want to do it in one shot, give it up. You don't get people together in one shot, it's off. You begin to say, okay, in this first meeting, this is what we're going to tackle. And now we're going to set up a series of meetings to look at what are the concrete ways we can bring this to life. Now, for me, when you're going to solve a problem, the solution cannot be um, one the only solution can't be is a date for the next meeting. So if you want to accomplish
mhm.
something in a meeting, at the end of that meeting, you need to have the solution. So the next meeting
Interesting.
you can move on to the next topic. But too often I
Mhm.
have found that people come together, they talk, and then the outcome of that is a date for a next meeting. No, no, no.
Yeah, yeah.
At the end of that meeting, you need to finish that topic. You need to state what your accomplishment is, but the meeting has to have enough guidance in it. Someone needs to be in charge and can't let it wander,
Mm,
so that you have a solution at the end. As you reference, too often people think a plan is what they're after. A plan is never the end, should not be the end result. The operation of that plan should be the end result. Hence, ready, fire, aim.
right. Thank you. Thank you. Um, so if you could wave a magic wand and pick one resource to have an unlimited supply that could meet a critical city need, what would that resource be?
It's probably changed a little bit over time, but I think given all my different sectors of government and
Mhm.
a wide variety of leadership roles, I have to come back to housing. If you don't have safe, accessible, affordable housing,
Mhm.
nothing else seems to stick.
Mhm.
And it
Yeah.
goes back to the hierarchy of needs. You have to have housing, you have to have food. When you try to provide these on an ad hoc basis and not stable, how can you focus on your health if you don't know where you're sleeping? How
Yeah.
can you focus on your health if you don't know where your next meal is coming from, much less figure out how do you take your medication? How do you begin to get a job? How do you begin to deal with your addiction, your oppression, if you don't have some stability in your life? And for most of us, the stability in our life came from knowing this is where I'm going tonight. This is where I can be. And I know that within that stability, I'm going to have nutritious food. We
Mhm.
keep trying. It took us way too long to try to understand that you can't provide healthcare in a vacuum. And we wondered why people didn't take their medication. And we were saying, and put it in your pocket. You know, the first deinstitutionalization of hospitals failed. And it failed for one basic reason. When people left, we gave them an appointment for a meeting to a health center. You give an appointment to someone who doesn't have a calendar, who doesn't have a watch, who doesn't have a clock. And then we blame them for not showing up.
Right, right, right.
So if indeed we need to begin to look at how do we stabilize their lives?
Mhm.
Once that life is stable and they have a place, I like to say to call home because I'm part of Project Home, but we have to give them a place that is a stable, accessible, affordable housing.
Yeah.
Then we can build in the supports and the supports stick.
Right, and I was just
So
gonna
if I
say
had to make so if I had to create one thing of where I would go back now and make the base. I would housing that base and build on it.
okay, thank you, and
And
I like how
and
you
I
said
know,
stick.
Katrina, you've been in the world of homelessness.
Yeah,
You know the importance.
yeah,
And I think we because housing is expensive, people want to skip it. They want to skip over, and then they wonder why we have recidivism. We want to know why we have high hospitalization rates. We want
mhm,
to know why people are living on the street.
right,
Um, And we have the answers. I don't think there are answers we don't have. I think we have to have political will to do what we know needs to happen.
right, right, and in the long term, it ends up being a cost savings, right? It might seem like it's expensive up front, but it's a cost savings and better outcomes in every other area, right? In
Absolutely.
every other
And
system.
it's a and every other system, if you
Yeah,
can have stable, affordable, accessible housing, everything else will build on top of that and ultimately save you millions of dollars.
yeah, yeah. And I appreciate you saying sticky. I'm going to use that from now on. It makes the other resources stick. So just a final question, and you have answered this in part in some of the previous questions I've asked you, but I'd like to ask you, what words of wisdom do you have for us all in the thick of our careers to be impactful?
You know, there are several things that I would say, and I do mentor people who are in the midst of their professional careers. The first thing I tell them is when you have opportunities to volunteer, to
Mhm.
learn, take it. Don't talk yourself out of it. Take the opportunity to learn. Secondly, take reasonable risk. In other words, if you can't take any risk, then you're going to relegate yourself to what you're doing. And you'll
Mhm.
probably become increasingly unhappy unless you can take the risk and move to another level. I just think that we are built to be able to take that risk. We do it in many places of our life. People don't always do it in their professional life, and I would encourage it. For another one for people in the midst of their career is understanding the importance of research. Let research and data drive
Mhm.
policy and performance.
Mhm.
I think sometimes people believe that's academic, but the research that's happening in our academic institutions is very important in teaching us what is going to work, or at least to consider it. So, my statement often is let research and data drive policy and practice.
Mhm.
And I think as young professionals or professionals that are mid-career, understanding the role of, of research and policy is just critical.
Mhm.
Another one would be to understand performance outcomes,
Mhm.
uh,
Mhm. Mhm.
and to make sure for any task, first we ask, what does success look like? So
Mhm.
you know where you're driving. If you don't know where you're driving, it's hard to determine when you get there.
Right. Right.
um, and to understand the importance of performance outcomes in that process. So understand, um, you know, let let yourself know what the expectations are. So you know what your goal is, and then set performance outcomes to get to that goal. Um, I also find too often people cannot answer the question, what does success look like? And my comeback to that is, how do you know what you're after or what is right if you haven't already determined that? And incidentally, one of the key for that is talking to people who are living the life. What does success look like for them? If I'm a person that's using drugs or have a mental illness or I'm not taking my medication or I'm homeless, what does success look like to me? Um, and if you can't relate to what success looks like to them, you're going to have a very hard time determining what success looks like to a program. We are only in this job because we have specific goals, I hope, to help someone else reach their goals. So we need to make sure we're all in sync. Um, Another one would be understanding government. If you are a nonprofit institution and you have a government contract, understand what it is government wants from you.
Mhm.
Understand how to get it to work for the people. Government is not perfect. So if government is asking for something that you don't think is realistic, you need to be able to understand it first. And then secondly, begin to give some feedback. I really do believe any government at any level wants to do no harm,
Mhm.
but that doesn't mean sometimes their policies don't have that as an unintended consequence.
Right.
And if those of us who are in the field can't say that, then we're letting it continue. And it's our responsibility to change that, and to work with it, and to have a critical piece of it. Um, Mistakes happen. We learn from them.
Mhm.
And if something happens that we don't think worked, then we try something else the next time, and
Mhm.
we see if that works. So, for me, you never give up, and you learn from everything you do, and you gamble on the future. My one of my favorite statements um, comes from Martin Luther King, and the arc of the universe is long, but it bends towards justice.
Mhm.
So we have we have a lot of future, as long as we're working towards bending it towards justice. In the long run, we will be okay.
Thank you so much. I think I'm probably gonna make a transcript of this and use it and read it over. I really appreciate you sharing and with such detail, very actionable things that we can learn from to do and take a look at as individuals and organizations. I really appreciate the ability you've had to be in government and to be able to be very effective in moving things forward when oftentimes government can be very bureaucratic. There's still so much opportunity and so much effectiveness that happens every day in government. So I really appreciate you highlighting that and how it relates to other systems. So thank you so much. I really appreciate all of your wisdom. I know that folks will watch this and enjoy and learn a lot from you. So thank you, Estelle, for everything you do.
Well, it's really been my pleasure, and thank you for not only having the vision to put this together, but staying true to what you wanted to accomplish. As you know, the road sometimes is not easy, and life has a habit of sometimes throwing little boulders in the way. But keep on moving because you will get there.
Thank you, Estelle. Thank you. You take care.
Okay.